Welcome. Today we will be doing a presentation on HIV/AIDS 101. My name is Abigail Barajas and my co-worker, my co-presenter is Jasmine Homar Perez.
Hello, everyone. So we're going to talk about HIV. And the first thing is what those HIV and AIDS stand for. So the H for human, the I for immunodeficiency or lack of, and the V for virus. AIDS, the A for acquired, the I for immune, the D for deficiency, and the S for syndrome. And just so you know, the human immunodeficiency virus is a virus and the AIDS is a syndrome. So you need to first get the virus for that virus convert in the syndrome. So, and how the HIV virus attack your body? Okay, so it's like this. We have in our body a cells named T cells, and T cells are the defenders of our body, the soldiers. So an average healthy person has a 1,500 T cells on the body. So on one drop of blood, sorry. So if the person becomes infected with the HIV, their T cells counts begin dropping. So from 1,500 drops to 500. So if drops below from 500, like 200 T cells per drop of blood, that person now is classified as an AIDS person, AIDS patient. So, and how the HIV virus attack your body? So it is simple. In here, we notice the HIV virus, the pink one, and the T cell, it's the green one. So the HIV virus enter to that T cells and start reproducing different and a lot of virus inside the T cells, okay? Copy itself. So it copy itself inside of the T cells. And then at the end, it kill the T cell. And those HIV virus go direct to your bloodstream in the body. So, and we have some infection fluids, and those infection fluids are the one that if you get in touch with them and that person is infected with the HIV virus, you're definitely gonna get infected. It's blood, semen, breast milk, pre-ejaculate fluid, vaginal fluid, and rectal fluids. And why they are infection fluids? Because these fluids are nutritious in your body. So blood keeps us alive. Semen, so semen, it's for make babies, you know, like it's nutritious, has a lot of proteins. Breast milk is for babies, feed the human beings. Pre-ejaculate fluids is a lot of nutritious for keep the sperm alive. And vaginal fluids, it's nutritious too. And rectal fluids don't have nothing nutritious, but a lot of people get in contact because the sexual behavior. So they are infection fluids. And non-infection fluids are these ones. If you get in touch with them, you're not gonna get infected with the HIV virus if the person is infected. So tears, sweat, and mucus. And why? Because these three are salty. So they are salty, and HIV virus don't like salty substances. Vomit, feces, urine, and saliva. So vomit, they are acidic. Feces, HIV virus don't like those. Urine, the same. And saliva, so the saliva is made for break down the food. So if you get an infection fluids in your mouth, the saliva is gonna break down a lot of times. So the HIV virus cannot live in the saliva. So, and how people get the HIV virus? through unprotected sex with the person that is infected, by sharing needles, and not only drug needles, it could be tattoo needles and piercing needles. And from mother to child. If the mother is infected and breastfeed the baby is gonna get infected too. So now we are going to discuss sexual behavior, and I'm gonna to pass that to my co-worker Abigail.
All right, so let's talk about the sexual behaviors that put you at risk. And I'm going to put them from the highest risk to the lowest risk. So the highest risk behavior is anal sex, and that is the penis in the anus. Also, vaginal sex. So vaginal sex is the penis in the vagina. And then we have oral sex, which is mouth to intercourse. I'm sorry, mouth to genitals. So anal sex is the riskiest only because the anus is not meant to be receiving things. It's basically used for, disposing, extracting. So that could cause some tears and, and some perforations. Vaginal sex is still a little risky because sometimes women have sex while they're on their period and now there's blood present plus vaginal fluids. Oral sex is the least of the um, risk, but there's still risk. One of the things that's really important is to make sure that you don't have any mouth injuries, and also don't brush your teeth immediately after having sex or before having sex, because when we brush our teeth we might leave some little abrasions in our mouth that could be an opening door for HIV to enter. And also, of course, share sex toys. So it's really important that you read the manufacturer's instructions as to how to clean them, because we don't want them to be infectious, right? Especially if they've been used in other people. So what we say is don't brush, floss, or if you have any mouth injuries, do not practice oral sex an hour before or after you've done that. So let's look at the next frame. So sharing needles, this is another way for people to get HIV, and that could be from injecting drugs, vitamins, steroids, or hormones. The substances in there is not going to give you the HIV. What's going to give you HIV is if you're sharing this equipment with someone who has HIV. Also, tattoos is really important, that if you go get a tattoo, that you make sure that they have fresh new ink, fresh new needle, and that the gun has been sterilized. The same thing with piercing. Make sure that you're not sharing any needles that have already been inserted in somebody else's body. Okay, let's look at the next frame. So how is HIV not transmitted? Well, it's not transmitted by touching, coughing, or sneezing on someone. You don't get it from a toilet seat or from eating utensils or from water fountains, or not from your phone because it's not virtual, right? Casual contact such as hugging, dry kissing, or sharing food, donating blood, or mosquitoes. A lot of people used to be afraid that they would get it from mosquitoes. Mosquitoes don't give you that. They can give you other things, but not HIV. So how to prevent it? So how do you prevent it? It's by not having sex. This is called abstinence, right? It just means not to do it. Not injecting drugs or sharing needles with anyone. Reducing the number of sexual partners. The less partners you have, the less risk. Using condoms. Now there are different types of rubbers. There's latex, polyurethane, or polyisoprene. And also getting tested. Really, people don't know if they have it, or you wouldn't know if you had it unless you got tested. Also, if you're practicing oral sex on a female, there's a good thing to use dental dams. Or if you're having oral sex on a male, make sure that you're using condoms, and they do have flavor condoms. They have condoms specific for oral sex. So this right here is just an image of a dental dam. It's just basically a sheath of plastic that you put over the female genitals before you practice oral sex. All right, getting tested. Now, this is, different ways that people can get tested. So the finger prick, that's when they stick your finger and they get a little bit of blood and they put it in a little vial. And it's actually like a little rectangle thing. And that blood gets put in there and your results come within 20 minutes. And of course, there's also the mouth swab. However, I think this is more commonly used like with public health. Also blood drawn, which is the most accurate one because you're going directly to the source, right? So this is what it looks like. So as you see these little rectangle things right here, they have a C and a T. So the C stands for control and the T is for test. So if you get a line on the C, that means that there was no antibodies found for HIV. If you get a line on C and the T, that means that they did find some antibodies. And so if somebody gets this result as a positive, that's not the only test they're gonna do. They're gonna redraw the blood and do some more tests to assure that maybe this wasn't a false positive. How does a person get a false positive? Well, if you go to the doctor to do a test soon after you had a virus, or if you have a virus, then it's going to show up as positive. That's why sometimes they have to do more tests to assure themselves that it wasn't a false positive. And if you have no lines at all, that means it was an invalid result, meaning they didn't get enough product to do the test. So you'll have to go back and do it again. All right, let's look at the next frame. So the window period. So this is the time that it takes. This is how long it takes for people to find out if they have HIV or not. So we're going to create a scenario. So the very first arrow that you see there, that is called the date of exposure, right? So that's the time that you might have been exposed. And do you know that you could pass the virus on within 24 hours of getting infected? And whether you know you have it or not. So the soonest you can get tested is 2 weeks from the contact, right? However, that's only about 5% accurate. So if somebody gets a negative result, I would encourage them to come back at least at 1.5 months, because now it's about 95% accurate. So if somebody still gets a negative there, I encourage them to come back at 3 months just to be 100% sure they do not have it. However, this is human, this is how humans are. If they get a negative at 1.5 months, usually what happens, people go, yay, I don't think I have it. And sometimes they go out and get a new exposure. So if somebody gets a new exposure and they get a negative result at 3 months, actually that's only a result that's going to tell you what happened the very first time. The second exposure you have right there, you're going to have to wait another 3 months before you find out what happened during that time. So that's why it is so important that when you do a test, that you stay abstinent, that you abstain from any risky behaviors until 3 months have been gone. So when you get your result, that is a true result. Once you find out that you're negative, then you want to protect that status, right? And if you're HIV positive, well, that's also okay, because now they have medication that you can start right away that can actually keep you healthy. So let's look at the next frame. So there's other ways to keep people healthy now, and also to prevent HIV. So PrEP, pre-exposure prophylaxis. This is a pill that a person can take every day to prevent HIV. It's about 98% effective when it's used correctly. We still encourage you to use condoms, of course, but some people sometimes forget to use condoms. That's why this is the populations that are using this product right now. People who get diagnosed with STIs a lot, sexually transmitted infections. People who use drugs and alcohol who don't remember if they did use the protection or not. Also, people who are inconsistent in using protection. Sometimes they do, sometimes they don't. We want to lower the risk. Partners who have an HIV positive person, is a one way to use it. You use PrEP and condoms, and it's almost 100% safe. People who are incarcerated for a long period of time, sometimes they request to use PrEP. Also, people who exchange money for commodities like shelter, food, whatever other reasons. Those are the people that we know right now that are using these products. Let's go ahead and look at the next frame. So PEP. PEP is something that someone can use if they believe they might have been exposed to HIV. In the past, we used to use PEP for health workers who would draw blood and would get stuck by a needle or something. They would use this medication to make sure that they didn't prevent, I'm sorry, to make sure to prevent the infection of HIV. So it's available at health centers. We actually have someone in our center. Unfortunately, it's not addressed anymore, but we will be finding out who the new person is, who you can talk to about maybe using the products for PEP or PrEP. Let's go ahead and look at the next frame. So there is medication. The medication is called ART, antiretroviral treatment. It's taken daily, and if a person takes this every day, it has been found out that it's actually HIV is undetectable. So it means that the virus is so low, right? And but what it also means is that if a person stops taking the medication, if they don't continue to take it, that whole process could begin to happen again. This is not a cure, unfortunately, it's not a cure yet, but it is a treatment that is very, very effective in lowering the viral load in people's bodies. Okay, let's go ahead and look at the next frame. So local statistics, I am sorry to say that we have not been able to get any new statistics for a long time. In order for us to get statistics, people have to get tested. And as you know, we've been in shutdown, right? I mean, for almost a year and a half now, almost, right? So we have not had a lot of people getting tested lately. We've been worried about other things in our world. And maybe that's why it's been, not the focus of the CDC to get us new statistics. But I'm going to say that back in 2015, we had 1,348 people living with HIV or AIDS. And it's estimated that it's still 500 people that don't know their status at all times. So in 2015, there was 27 new cases. And people say, so what? It's only 27 new cases. But what happens with transmission? Just like we're dealing right now with the COVID, right? One person can walk into a room if they're infected, whether they know they have the virus or not. Let's say there's 50 people in the room and they hugged about 50 people. I think that maybe about 50 people have been exposed to it, and we don't know if 50 people will get it, but at least half of them will probably end up with COVID. So same thing here, right? 27 people go out into the world and have unprotected sex, and maybe 27 people will get infected, and then those 27 people will infect someone else. So you see how transmission works. So that's why we don't even want anyone to be dealing with any of this. So it is best to lower even those cases down to zero, right? Wouldn't that be awesome if we could just get rid of HIV? We're still working on that. Hopefully one day that's going to happen, and maybe they'll just have a vaccine again to protect us from that. But as of right now, that's not what's happening. So let's go ahead and look at the next frame.
And the next frame is the last. This is our information. So if some of you have some doubts, questions, and want to communicate with us, this is the Abigail information, email and phone. And this is my email and phone. And we are available at Santa Rosa Community Health. So we are here for you. If you want to communicate, just give us a call.
All right. Thank you. Thank you for your time. And hopefully we will see you around in our centers. Bye.
Bye. Thank you.